Hi, hello, welcome back. Let's discuss an interesting bone tumor today. 7-year-old child presented with pain over the tibial shin. This is the radiograph, which is showing an abnormal, bizarre appearing lesion, which has typical ground glass appearance and thickened sclerotic cortex involving the diaphysis of the tibia. You're also appreciating in coronal view AP radiograph where you're able to see the sclerosis here. So based on this, it's a antimony. We have diagnosed this case as osseous fibrous dysplasia. The typical features are ground glass opacification, deformity of the bone. It has a variable appearance. T2 it will be hyperintense, T1 it will be hypointense. There will be some cystic changes. All these things are hallmarks of osseous fibrous dysplasia. Fibrous dysplasia is a benign developmental disorder. It occurs due to sporadic gene mutation. It has two forms, monostotic form and a polyostotic form. Patient may present with pathological fractures and very rarely they can be malignant transformation. Classical hallmark features are ground glass opacities in 56% of the individuals, sclerotic pattern in 23% of the individuals, and cystic appearance. In our case, all the features were present: the cystic appearance, ground glass opacitation, then also there was deformation of the bone, the variable signal intensity, and there will be milk cloud-like appearance in osseous fibrous dysplasia, which you should be knowing. Pathognomic signs and age-related evaluation are mainly ground glass matrix, most characteristic feature best seen on CT scan. There will be histological replacement of normal bone architecture with a irregular woven bone. That is why you get this. This is mainly because of the mutation. Rind sign is the thickened sclerotic reactive layer of the bone in the periphery, in which in our case we were able to appreciate. And also last one is the deformity. Pronounced varus angulation is called Shepherd's Cook's deformity. So multiple deformities can also occur. Other differential diagnosis consideration for this is you have this soap bubble appearance. This is typical soap bubble appearance. You can consider osteofibrous dysplasia in a younger age group. If it is older age group, 20 to 50 years, and larger lesions, 10 to 17 centimeter, you should consider adamantinoma. Other differentials like aneurysmal bone cyst also can be considered, but in our case, fluid levels were absent. Common sign again in osseous fibrous dysplasia is a ground glass pattern. Less than 1% there will be malignant transformation. In polyostotic fibrous dysplasia, there will be 4 to 6.5% malignant transformation. So these are the features of osseous fibrous dysplasia. Very antimony. You should not diagnose it as some other bone tumor. You should be careful while labeling it. Thank you very much. Hope this case on osseous fibrous dysplasia was useful for you.